Is child development able to come?
No,
No.
but they have something.
Okay.
Correct.
And folks, just don't forget to mute yourself when you're not on.
Oh, thank you, Luke.
No problem. Good afternoon, folks. We'll be starting shortly. Just letting a few more minutes for folks to join the session. Hi, Bernice. Is your audio working? Everyone was just on mute. We're just waiting for folks to join. We'll start momentarily. All right, folks, I think we could begin. Welcome. Thanks for everyone joining us for the second session for the Campus Reopen Q&A. Let's see, Jeannie, do you want to go first and just go ahead and provide an update from child development?
Yes, good afternoon, everyone. Thank you for being here. And one of the last sessions, a question was asked in regards to the Early Education Center. And we reached out to Berta, and unfortunately she couldn't be with us today, but she did provide some information. And then I also noted that was also a follow-up question on the questions that were submitted in advance. So hopefully we have some information that, okay, I cannot share the screen. So we had she provided just some quick information on PowerPoint, and there's the opening. They had the opening of the Early Education Center in June, but if you can just go to slide 2. So our Early Education Center associated with our Child Development Program is a subsidized program, right? We receive funding, and its main mission is to serve low-income families, and then children in the age range of 4 months to 5 years. That 5 years being as long as the student is not eligible for kindergarten. So I didn't see a specific age range mentioned in association with the question, but what the Early Education Center, led by lead faculty member Berta Harris, and she's actually the center director, I need to correct myself, is they are looking at a pilot to maintain a waiting list for college employees who have children that fit that age group. And then if the enrolled families do not fill the space full-time, they will pull from that wait list. And then very briefly at the end, she had mentioned, shared her direct office number, which she's around often enough, and then her email. So if you have questions, please feel free to reach out directly to Berta Harris. And that's all that was shared at this time. So we are looking, so to recap, we're looking at a pilot in which college employees could get on a wait list and then would be pulled from that wait list if you have children within that age group. So I think it sounds promising, right? And was real thankful to hear that the Early Education Center director and staff are thinking about that and looking into it. Thanks, Caesar.
Jeannie. Folks, all the attendees, please, if you have any questions, please drop them in the chat. And we could go to the questions that people submitted. Let me pull it up here. See, we could go over the questions, and if folks have answers, please feel free to answer them. So we have one question here. Let's see. It's for a student. He signed up for a lab class in the fall. He had COVID in May, and his doctors advised him to not get the vaccine until August. He will do that, but since he has to take the 2 shots, he will not be fully vaccinated before the lab starts on campus. He wants to take the course and not be delayed a semester. He's currently signed up for the course and does not want to be automatically dropped. What can he do?
So I can share, I attended, and the reason I'm here, everyone, I should have shared initially, our VPI is on a much needed vacation. She does so much and she's available 24/7. She really needed some time away to regroup and recharge. So I'm acting VPI this week. So I attended, actually, and Dr. Parker did too. I didn't mean to jump over you, John, but the district COVID safety meeting on Wednesday morning. And this was actually brought up. It was our current information out there on the website indicates that by August 6th, right, they have to prove or be vaccinated. And then the question came, is that 2 shots in 2 weeks, or if it's Johnson, the 1 shot in 2 weeks prior, what does that deadline actually mean? So all the HR and student services and all the departments were represented that morning. And that is something that they are looking into and will take back to Chancellor's Cabinet next week. And we will get information on that, what that August 6th deadline actually means. So that information it's also been asked in other places, it's on the radar, and the answer is forthcoming.
Thank you, Jeannie. And thank you, Luke, for adding the questions to the chat here. Question, are all students and staff required to be vaccinated?
I can take a stab and say that for students, if they are going to be on campus and enrolled in a class that is going to be meeting on campus, then they must either be vaccinated and or have an exemption from for that, which means that there will be some students who will have an exemption, meaning that they are not vaccinated, but that they will be on campus participating in whatever it is that they have signed up to do. So again, in a few minutes, I'll be able to share a little bit about the vaccine exemption process for students, and I'll share how students do that. But students are just like are all of our faculty, classified professionals, and staff on campus have an opportunity to go through an exemption process for religious and or medical reasons. Now, I also want to make it clear that the exemption process for students is only related to the classes that are happening on our campus. So if a student is signing up for a class that, for instance, and we'll use nursing as a good example, where they have requirements where they have to go onto a clinic for site, those clinics and sites are not necessarily providing any kind of exemption. So students would not be able to participate in that. So the exemption is only to be able to participate on our campus for the class that's happening on our campus. And there are lots of other programs that have requirements where students are doing field work or doing internships and things like that. And those, we have to follow the guidelines and the recommendations from those sites, that what their requirements are, and most of them are not allowing exemptions of any kind.
Thank you, Marciano. Are masks required? Are plexiglass placed? And Lysol wipes in every room? And social distancing?
Real quickly, Cesar, before we move on to that one, if I could just dovetail or add on to what Marciano was sharing, was in regards to students. It does somewhat apply to faculty and staff as well. But I did want to point out that because exemptions are permissible or out there, and therefore, I think I read somewhere, somebody asked about it in relation to it being the honor system. So if you are an instructor who has a class that is fully face-to-face or part of it is on campus, with some exceptions like nursing that were noted, if the student appears on your roster, your final class roster, you can be assured that they went through the process, whether proving they're vaccinated or accepting an exemption, right? Nobody's going to have I call it the Scarlet V now, right? Saying that they've been exempt. So if they show up on your, I'm glad I can make Dottie laugh. If they show up on your roster, they have gone through the process in some way, shape, or form. And we are not going to monitor and say, you know, okay, who, right? We're not going to put people on the spots. But really why I started to mention this is that's one of the reasons why, yes, masks are required when you are inside campus spaces and buildings, because we are going to have a mixture of faculty, staff, and students who are vaccinated, possibly unvaccinated, and we're not walking around with Scarlet V's. So that is one of the concessions made to ensure additional safety, right? It's a safety practice. And okay, you move on now. Unless Dottie had something to add.
Going back to the mask question, yes, masks will be required for all employees and all students on campus, whether vaxxed or not, just as an extra precaution and to obviate any mask shaming or ostracizing individuals. So masks will be required for everyone.
And will there be Lysol wipes in every room? Social distancing? John, would you like to?
So I'll start with the social distancing or physical distancing is not required by the state. It's not required by the campus. It may be required in certain circumstances. If you're having lunch or eating or drinking with someone with your mask off, you may want to consider social distancing or physical distancing at that point. But in the classrooms, in our workspaces, so social distancing will not be required. There have been requests, however, from a couple of departments who would like to maintain social distancing. I was explaining on another call this morning, we ordered over 1,000 6 feet social distancing stickers for the floors that looks like we may not even need to use, but a couple of departments have requested themselves. I would think that that's at your discretion. If we want to err on the side of conservatism, by all means, we have the stickers, the placards to place on the floor. For wipes, we haven't considered it for every classroom, but that's a discussion that I'll need to have internally regarding the wipes. And we'll definitely have the disinfectant, but the wipes we have not considered. That will take under consideration.
Thanks, John. Moving to the next question. Will you be hiring extra maintenance workers to keep everything sanitized? How many students will be in a room? Are smaller class sizes considered?
And if I can take the facilities custodial, there has not been talk or consideration of that due to district policy and hiring and the cost that comes with that. And honestly, it may not be tenable. We'd probably have to double, at least 50% increase the staff by 50% with facilities, but they do a very good job on a daily basis. They can't possibly clean multiple times a day in each area or classroom, but they are maintaining the high touch, high traffic common areas, elevators, gathering spaces, if you will. But in terms of classroom and working spaces, they will maintain their normal schedule, with Friday being dedicated as a deep clean day. Please,
Go
Doc.
ahead. Go ahead, Dottie.
Could I add a little onto that, Dr. Parker and
Yeah.
Cesar?
Yeah.
I just wanted to reinforce, when we all were sent home a year ago, we were trying to figure out this virus and its main mode of transmission. And certainly, I believe we found that there may be some cases where there's contact transmission, hand to mucous membrane or such, but it most definitely is not the main mode of transmission. So I just want to reassure, again, we all feel good when we see people bleaching things down and wiping. But even if because, our facility staff were to wipe it down, every other minute, someone could come by and touch things. And so I would just really advise folks to remember not to touch your face, to wash your hands. And the way I cope with it, you guys, and I think maybe a lot of you do the same, is I have a mini Purell or a spray alcohol. And because I don't know what we're doing with the grocery carts or other things. So to make yourself feel better, I would remember that it is not a main mode of transmission. It is aerosol and respiratorily spread. And just keep up with that basic tenet of washing your hands and not touching your face. And I think you can keep yourself safe the way we all did, or not all of us, but we kept pretty darn safe until we had the vaccine with distancing, masking, and hand washing. So I just wanted to add that on.
Thank you, Dottie. Great points.
Did anybody want to chime in about the number of students in the classroom?
I have to scroll back up and see. What was that?
How many students will be in a classroom?
Oh, okay.
Are class sizes considered?
So speaking on behalf of the VPI, what's already been planned to be on campus for fall has already been established, and those plans will not change. Anything that is, we don't have plans at this time to convert anything from online and now bring it on campus. That opportunity is somewhat past, right? We have a plan in place and we need to move forward, recognizing all guidelines and regulations, and do the fall semester really well with what we have planned. So all of those numbers are already known because we've been planning for it. So on campus, we will have some fully face-to-face classes, and those are primarily lecture classes that have been placed into our largest spaces on campus. I'm talking like BT 301, which holds like 65, and then even the black box theater, we're using that as a space right now. So using those examples, we've already gone around and looked at like in a BT 301, in a space where 65 could be, we're probably comfortable with a fully loaded class of 35, and those tables wheel and whatnot. For classes that are coded or considered partially online, that some of the time will be on campus and some will be online. we've also looked, and it's there's not a magic number, right? It really depends on the size and space of the room, and working with the dean, the department chair, and the department, what is comfortable with how many can be in there. So in the words of the great Tilly Chavez and President Shabazz, it depends.
Great answer, Jeannie. So another question, what is the final deadline for answering the questionnaire about our COVID-19 vaccination status?
Are you talking for faculty and staff? I'm not aware there was a deadline. It's just that the email from Vice Chancellor Smith stated that in order to come back to campus, that should be done. John, did I misread that?
Yeah, the deadline would be prior to coming to campus.
And for students, it's August 6th.
Yes.
Thank you. Let's see, even though it's not required, will office be allowed to have 6-foot signage outside their offices for Lions to create social distance?
Yeah, as I alluded to, suggested a moment ago, we do have them, although it's not required, but they will be allowed to, departments will be allowed to enforce. So we'll just need the request for the floor stickers submitted to business services, and we can arrange for pickup or delivery. Well, actually, we'll probably need to work with facilities on that, but send the request to business services anyhow.
Will faculty have authority and or be expected to enforce mask wearing in the classroom? Are the classrooms that will hold in-person classes being outfitted with ventilation?
I didn't understand the ventilation question.
And I believe it may be talking about like the air purifying. I think that was discussed at previous meetings.
Yeah, yes, all of the filtration system, HVAC systems have been tested and meet, and in most cases exceed CDC standards for MERV 13. The HVAC systems are built for specific filters, so we cannot increase the MERV level. Say if it's a 13, we cannot increase it to a 15 because it creates a strain on the systems, but they all meet or exceed the CDC requirements. And for those who may not have been on a particular Zoom or presentation, the buildings are the HVAC systems and the buildings are balanced and pressurized. And as long as the system is on, we cannot have the doors or windows open, as it'll throw off the pressure and the effectiveness and efficiency of the HVAC system. And in terms of personal air purifiers and or ionizers, the district will not be providing for those in workspaces. We don't have the funds to provide for those, and it wouldn't be any more effective than what we're using now with our MERV filters.
And, can somebody just talk about a little bit about like enforcement of mask wearing in the classroom? Will faculty have the authority and or be expected to enforce mask wearing in the classroom?
Jeannie and I could probably tag team this one. So I can just tell you from the student perspective, all the students, when they submit their either vaccine verification or they submit their exemption and they're approved, they get something that basically says you have now been approved to enroll in the class that you're trying to get in, right? Because they're going to be on campus. And all of those students also are going to get information that says, these are the requirements that even though you have been approved as either being vaccinated or exempt, you must wear a mask in the class at all times. They're going to get information about the policy 3100 that basically says failure to abide by these rules could result in you being removed from the class, and a policy 3100 being filed, which means that they would then come and meet with me as the dean of students to deal with that. So in terms of from an instructional standpoint, you would do what you would always do, is that this is part of the expectations of being in a class. And if a student is not abiding by that, then we're going to remove the student. We're going to ask them to meet with the dean of student affairs before they can come back to class. And I will have the conversation with them about if you're going to continue to be in the class, you must wear the mask, or you're not allowed to be in the class. Real simple. They have a choice.
Thank you, Marciano. Perfect answer. And thank you for pointing out that they do somewhat or in some way or fashion agree to that prior to joining the class. And so, you know, this morning I was attending, I'm a 2021 fellow for the National Community College Hispanic Council, and we had a session this morning, and the speaker was actually Dr. Mark Sanchez from down the road from Southwestern, and he's talking to us about leadership styles. And he was reminding us that we're not coming back to the same city college that we left in March 2020. But what we will need to remember and regroup on is our best classroom management skills that we all know we have, right? You veteran faculty who have been in the classroom, you know classroom management, you know how to engage and effectively work with your students. But there will probably be incidences such as this, and Marciano just shared what we can do. There has been talk for our college of doing some orientations or maybe some workshops and providing faculty with some additional strategies or recommendations on how to address it and then move on, right? We don't want to escalate it to the point where it becomes a paramount issue, but I have faith in the faculty here on our college that you know classroom behavior management and you know what to do. What I will share though is that I was talking with, I have visual and performing arts in my school, and I was talking with the dance instructor who recognizes that they will be trying to do some dancing and move with masks on, but I thought that was really great. I was like, oh, why didn't I think of this before? But what she's already talking about in designing her classes for fall is to build in, she's going to call them mask breaks. They are going to take, okay, it's a 5-minute break, go outside, take off your mask, breathe some fresh air, you know, maybe cool down from whatever exercise we were doing. So that may be something that classroom instructors may want to consider when designing your fall classes, or build in mask breaks. Take 5 and walk outside and remove the mask and get a breath of fresh air.
Thanks, Jeannie. If I can ask, can you elaborate on the students? They'll know the policy if we have students that are defiant, just absolutely defiant in the classroom.
Yeah. So again, it would follow our policy 3100 process. So a student can be removed by an instructor for failure to comply with the regulations of the class and our student code of conduct. So they could essentially move the student from up to 2 class periods, and that the student would then be required to meet with me to clear them to come back to class. And we would follow our student conduct process. All of those students, again, when they apply for the exemption or when they submit their vaccination cards online, there's these check boxes that they're saying, I agree that even though I'm going to be exempt, I'm going to be wearing a mask in class. I agree that I'm following all the policies. So there's a system where they're all agreeing to all of those things. So there shouldn't be any students that will show up on campus to say, I didn't know that I didn't have to wear a mask. I also will say, we're going to have places on campus where a student, if they forgot a mask, can come and grab one before they go back into the class. So an instructor can say, if you forgot your mask, go over to the Welcome Center and grab a mask and come back to class. So we're going to be, we know that we've done this. At least I know I've gone someplace and all of a sudden like, oh my gosh, I walked out of my car and walked towards the Starbucks and forgot that I didn't have my mask. And I go back and so we know that that's going to happen in classrooms. And so we're taking that into account, that we'll have some places where students can get a mask. But if a student is absolutely defiant, I would say, the instructor really shouldn't have to deal with that as much as sending them to us, and then we're going to deal with it from the following our process. And students just won't be allowed to be in the class if they're not going to wear the mask.
Great, thank you. Just wanted to elaborate on that. And also, you may have mentioned earlier that it's not a situation where we would involve campus police as well.
Correct. Yeah, we're not going to have them going into classrooms.
And Luke, mentioned the welcome centers. So that would be one of those spaces where somebody could also maybe not have to go all the way back to the parking structure, drop by a welcome center. And here's a nice City College mask.
Yeah. The welcome centers are definitely going to be located in key areas at student services. And also we're working with Vice President Chavez to really have those centers near where the active classrooms are. So they're gonna have to check in and do those things. So they're going to be given that mask. And if for some reason they were able to, just jump right in, we'll have masks and available for them, branded ones and whatever they feel comfortable having, hand sanitizers, those things like that. So we'll definitely have stuff for folks that come through our welcome centers. Absolutely.
Cesar, I think we missed some now. The chat was getting full.
Here's a couple. Maybe this one's for Dottie. Can you share any information regarding the Delta virus? What do we know regarding our zone, and how is the district planning for it?
Thank you. Delta is one of the variants that is of significant concern right now. It has mutated to be much more transmissible, much more easily contagious or infectious, if you will. There's also a Delta Plus variant. The worries are that each time this virus gets into a person, it is mutating, it is changing, it is getting better at what it does, which is transmitting and making us sick. Our hopes, our dreams are that it will not become a more virulent, a more killer virus. I wanted to specifically address the question asking how many are in our area in San Diego. We've had 54 cases, 4 hospitalizations, and 1 death related to Delta. And Delta is definitely the primary circulating viral mutation of concern right now. If you are vaccinated, to the best of scientific knowledge right now, you don't need to exceptionally worry about Delta. You should be covered from your vaccination status, assuming you've been fully vaccinated. If you're unvaccinated, Delta still poses a significant risk to you. I don't know if that fully answers the question.
Oh, that was good. Thank you, Dottie. And I know the district, we're still moving forward with just the COVID-19 protocols, and so we will plan accordingly if the variant does require us to do so. Let's see here.
I saw some questions about the FDA approval, Cesar.
Oh yeah, please.
So the question was posed that will the district mandate this vaccine though it's not fully approved? So it has been approved for, I believe, is it 7 months for emergency use authorization, which is sometimes abbreviated EUA. It has not been as yet FDA, Food and Drug Administration, approved. And that concerns a lot of people that it hasn't gotten that official stamp of approval. I will tell you that we have given over 187 million doses in the United States. We have given 3.32 billion doses worldwide. Dr. Eric Topol, who is a molecular medicine professor at Scripps Research Translational Institute, can be quoted in an opinion piece where he said, few, if any, biologics have had safety and efficacy scrutinized to the degree that this vaccine has been. The mRNA vaccine has overwhelmingly proved safe and effective by the fact that it had complete clinical trials done, you guys. Nobody took shortcuts. It's had independent research, and it's based on the experiences of billions across the globe. And so that's the scientific answer. And then the personal answer is, as a nurse of 40 years, I have very often heard a patient or family member ask me or their doctor or nurse practitioner, if it was your mother, if it was your child, what would you do? And my answer to that is the two most happiest days of my life were when my sons got vaccinated. 4, because they had 2 shots each. But so from a scientific standpoint and from a personal standpoint of, I would not have waited for FDA approval. For me and my family members, the emergency use authorization and the data I just passed on was enough for me. I do believe the FDA authorization is coming very soon, and the medical community is sort of pushing back about that, asking why, come on, let's do this, because people are waiting and seeing based on this FDA approval. But I would urge you to look at the other scientific data to present data to yourself about why you may not feel that you have to wait for FDA approval. Realize that there's lots of things on your grocery and CVS shelf that have not been FDA approved. Thank you.
Thank you, Dottie. Here, another question. Will students who are unvaccinated be on campus? Will proof of vaccination be required or merely the honor system?
I think we kind of jumped into that. I can recap in case it's somebody just joining us, but I saw that on the list earlier and it was closer to the top of the hour. But at this point, as Marciano shared, and I think John Parker also shared somewhat, that right now, in this moment, the requirement is that all students participating in an on-campus instructional activity, i.e. registered into an on-campus class, that is the requirement. And they have to, by August 6th, provide proof of that vaccination status through the JIRA system. Or, and Marciano said he would show it in a bit, they can request an exemption based on 2 factors, but they also have to go through that process as well. So the answer is yes at this time.
Thank you, Jeannie.
Caesar, could I address the thing about individuals having encountered severe adverse reactions after receiving the vaccine?
Yes, please do.
Or died? So I don't have that number. And let me try to tell you how it goes, whether you're getting a mumps vaccine or a tetanus shot or flu or the COVID shot. You will be educated prior to your injection. You will be told to call the vaccine adverse reaction, to call or register in some way if you feel you've had something untoward happen to you after receiving the vaccine. So I've assisted with vaccinating thousands of people in San Diego since the vaccine came out in January or February. We were very real, authentic with the patients, saying, hey, if anything strange or that you don't understand happens, be sure and report it to VAER. So what happens, you guys, is a patient may get home and faint the next day, or their foot may hurt, or their elbow itch. And I'm just saying a lot of things happen to people. And so those things probably have all gotten reported. Okay. So whatever that number may be, I don't know what it is, but then it's incumbent upon the scientists to say, okay, we got 300 reporting of this happening, and to find out if there's a causal link between getting the vaccine and something not great happening. So you all have probably read that it's believed that there is a correlation sometimes between the vaccine and, say, some cardiac issues. When you hear these cases, please understand the numbers that you're dealing with, and that science is still trying to figure out what is causally related. and what is not. That takes some time. And again, I would urge you to look at 3.32 billion doses given in the world and whether your risk of getting an adverse effect from the vaccine is greater than your risk if you get COVID-19. I don't know if that helps.
Thank you, Dottie.
The other thing, if someone dies after a vaccine and they're 88 years old, you know, did they die from the vaccine or did they die of their other comorbidities, their other illnesses that they have by virtue of being an 88-year-old? So it's going to take some time to sort all this out, you guys. But it has been designated as safe for emergency use. And I think FDA approval is coming. And 3.32 billion doses is very reassuring to me.
All right, next question. Can a manager ask staff or faculty what their vaccination status is, or does that question violate HIPAA?
I'm not sure, or Dottie will have the exact answer. I'm not sure if it violates HIPAA per se, but it's at best practice. It's just not something we would do, right? HR has the information, and as a dean for my school, if you know, I think if there was anybody I was really, it's not my business, right? We all go through a process that we are required to do before we come back to campus. And I guess maybe the bigger question would be back to the person submitting it. Why would we? But Dottie, go ahead.
From everything I've read, it does not violate HIPAA. And right now that I did the reading on HIPAA a while ago, and I can't pull up exactly why HIPAA may not apply in these cases. But again, I think what Jeannie said is really important with regard to the norms and customary practices of us in the district as we work with one another. I don't know if that helps.
If I can just piggyback and just say, I think the important thing to note there is a reminder that all faculty and staff and classified professionals are going through the same process. So we're all either uploading a vaccination proof of vaccination or the exemption, and HR is going to clear you to come back. So if any of you have already done it, you know that you get an email after a few days from Human Resources that says your exemption is approved or your vaccination requirements have been fulfilled and you may now return to campus. So you get something from them, and that's the same thing that all of us are going to get. So we're going to assume that anyone that's on campus is either vaccinated or has an exemption, which is why we're going back to earlier to say we're all going to be wearing masks because we don't know who has the exemption and who is vaccinated, nor should we care about that at that point, because we're all going to be wearing masks when we are around each other in doing, handling the business. Now, that doesn't mean that if you're sitting in your office and no one's around, you don't have to wear your mask, that kind of stuff. But when we're interacting with each other, when we're interacting with students, when we're in closed spaces, for meetings, we're all going to be wearing our masks. And again, that's a way to not try and shame anyone who's not vaccinated. Because again, for people may not be vaccinated for different reasons. I mean, we know that there are medical reasons and that there are religious reasons why someone may not be vaccinated. And we don't want to make anyone feel bad for that being the case. So we're going to do our part and assume that everybody that's on campus has been cleared to come back, and we're going to wear our masks and protect ourselves.
Great answer, Marciano. Luke, would you mind just going over just a little bit of what the welcome centers will involve for the folks who are new or haven't heard about the welcome centers yet?
Yeah, of course. So the welcome centers are going to be an awesome resource, not only for our students that are coming to campus and prospective students, but really for our staff and faculty members and administrators. Now, our welcome centers are going to be, strategically placed around campus, whether it be student services or facilities that are actively working with students in the classroom. And we're really going to coordinate with the vice president's Chavez, along with her faculty members, to ensure that our welcome centers are open during the time that classes are available, or in student services when student services is open to servicing students. Now, the welcome center is going to be a hub for students to check in. Obviously, last week we discussed the idea of how we're going to check students in, and week to week it kind of changes a bit, but there will be a process for students to check in, whether that be via app or via a form that students fill out. Beyond that, we are going to be providing PPE, not just reusable ones that are branded with city colors, so they feel great about it. But we will also have a check-in process. We did purchase 4-inch stickers that we're going to physically write the date out, so students can't just use it every day that they would come into campus, and it's going to be very visual on the shirt. But we also wanted to respect like privacy, etc. So we will have lots of great resources available at the welcome centers, and not just PPE, but items too. A schedule when offices are open, or even some protocol and some great signage that Kim and Caesar already know that we're working on. So lots of great resources that the Welcome Center will kind of be at. And again, like I discussed last week, is if you have an office, if you're a professional that you want to collaborate with us, please reach out to us. And we would love to see what we can do to get these folks out. But it's also going to be a time too, so we can kind of help triage students. And we'll have outreach ambassadors, peer mentors available there, that we can really see what the student needs to help them to either get to their classroom or into student services. So lots of great things happening, and more details are being flushed every single time we meet and every week. So we're definitely excited to get these welcome centers out to support the campus community.
Cool. Thank you, Luke.
Yep.
Marcio, did you want to share information? You should have some sharing screen rights.
Got it. So I just wanted to briefly go over the student vaccine exemption process. I've had some questions from folks. Can you all see that? Hopefully. Okay, perfect. So the student vaccine exemption process, students who are trying to get an exemption will visit on the SDCCD website. There's that website there for COVID-19. And then there's a frequently asked questions about COVID-19 impact on students. And one of the questions says, I cannot take the COVID-19 vaccination due to medical or religious reasons. Is there an exemption process? And the student answer is there. Yes, students submit we're using JIRA for students to submit their petition. That request is due by August 6th. And the reason that August 6th is chosen is because it gives students then the opportunity to, if they're vaccinated, and going back to Jeannie's question earlier, or the question that Jeannie was answering in terms of, will students have gotten the 2 weeks note, the vaccine plus 2 weeks. So by August 6th, it will give them chance to, that if they get vaccinated, they will be then, by the time the classes start, would have had that 2-week window. All of these petitions are being reviewed by the Vice President of Student Services at each of the campuses. We actually have a training at 1 o'clock today through Human Resources. We're following the same process that they're following for employees. We're going to follow for students in terms of granting exceptions, so that there's some consistency with that. And students will be notified whether their petition has been for exemption has been granted or denied. And again, the students, when they are granted the exception, will also tell them that although the exemption has been granted, that they still must wear the mask, that they need to still abide by the student code of conduct. And again, it'll also remind them that if they are enrolling in a class that has off-site requirements, that the exemption does not apply to those off-site requirements, that it only applies to their classes on campus. And if a student is not denied, or a student is denied for whatever reason, then they were going to get information about, hey, if you tried to enroll in this class and your exemption was denied, but you can still enroll in an online class, and it'll give them some options, or give them an opportunity to meet with someone to talk about options for switching into an online class that will still fulfill whatever that requirement. Because again, we're not trying to keep students from enrolling in classes. We still want them to stay on track with their ed plan. So there's plenty of opportunities for them to do that. And I think we've said this before, I know we've had a lot of conversations, but there is not a ton of classes that are happening on campus. Most of our classes are still happening in this remote environment. And so this is just for those classes that absolutely, for whatever reason, needed to be on campus. They have lab requirements or hands-on requirements for licenses and things like that. And so those are the ones that the students that are typically asking for an exemption.
Thank you, Marciano. Let's see, a few more questions here. Are there any plans for any food services available on campus?
I can respond to that. At this point, we are assessing with food services based on the scheduled classroom and the schedule of each department. And I do know that the C-store, I believe it is, and coffee services will be available until approximately 1:30. We haven't determined yet food services. That's forthcoming once we look at the class schedules and department schedules. And vending also, vending services will be available to those respective buildings based on those schedules.
And John, before the cafeteria opened as well, we had food trucks. Are there any talks of having food trucks on campus as well?
I think that's going to come out of the same analysis, the cafeteria and the food truck.
Another question about COVID numbers. Let's see, in the past year, we've learned that COVID appears to have a 98% survival rate. What percentage of community members need to have survived COVID for us to move into community immunity?
For me to try to answer that in these last few minutes, Caesar, is it possible that I could share my screen?
Yeah. Go right ahead, Dottie.
Great, it's not there, the picture I want. I didn't have time to prepare this in advance. I can definitely get it pulled up and go into it in more detail at our next meeting. So community immunity is what we previously or often call herd immunity. So in the initial stages of this pandemic, remember there was misinformation around acting like we should let the virus run wild because eventually we'll all get immune. Well, yeah, but we'll have a whole lot of sick and dead people in its wake. When we're talking about aspiring to herd and community immunity now, it is with the assistance of the vaccine. So we have some people that have had COVID that have mounted an immune response, but the majority of us have mounted our immune response based on our vaccines. So the idea, and I have a visual that can say it much better than these words, is that you've got some isolated people with the disease, and it is not going to be transmitted person to person as easily or readily because hopefully most of us have been vaccinated. Now, the number at which we have attained or reached herd or community immunity so that it is not spreading as well, I'm not sure what the latest data is or what is being said about that. I think it was hovering around 70%. And to my knowledge, I don't know if some or many communities in the United States are at that high level of immunization. Maybe Dee or somebody else on the panel knows more, but I do not believe we're at herd immunity yet. And many countries in the news are barely beginning their vaccine campaign. They're nowhere near that. So we are not. And so I guess the main point I wanted to make to the person that asked the question is I don't think you want to try to understand herd immunity in terms of survival rate. And just to caution everybody, survival rate, 98% survival rate. If you get it or your family member does, it's 100% for you. But anyway, so I will try to prepare something a little bit more on herd immunity for next time, if that's okay, Caesar.
Yeah, please do. See, we have a few more questions here. Can we adjust our remote services so we can work from home? I think there's another question too. If we can perform the same duties at home, why can't we work from home? I don't feel comfortable working on campus and de-escalating angry students. Also, students' needs will never be met with lack of employees, regardless if you're on campus or remote.
Well, I could try to answer in terms of, was the first question, can we continue to work remote?
Or can we adjust our remote services so we can work from home?
Yeah, that is a district decision based on VC Greg Smith's email, and at the district level or at the campus level, we do not have any discretion to override that. Of course, there will be exceptions on an appeal and approval basis, and they are just that, they're exceptions. So to be on a case by case, but to have a blanket approval to do so, that won't happen based on VC Smith's communication.
And Marciano, as our acting vice president, really helped educate us that the students have definitely, their voice has been heard. They want to be seen in person. They want to try to, many of them, most of them, want to engage in their education in person. And, you know, we've chosen a field of high touch person contact, right? Education, nursing, medicine. We didn't choose, I don't know, graphic design or computer work, things that don't involve maybe as much people. And I don't think we should make the assumption that we're going to have a large group of angry students. I don't think they're going to be angry. I think they're as happy as all of us to get back. But sorry.
You're right, Lottie. Sorry, Jeannie.
Go ahead.
But I was just going to indicate that that's actually what the surveys are indicating as well. And correct me if I'm wrong. I mean, they're at accreditation implications also for on-campus support services, long-term anyhow.
So then in the 3 minutes we have remaining, somewhat related to that, then can we quickly address the requirement for them to go through the process to prove vaccination or request an exemption for on-campus classes versus students or public who want to come on campus for services? What's the requirement there?
To come on campus for services, although they are not going to be in the class? Is that the question? It would be the same requirement, the vaccination or exemption requirement. Just to come to have an appointment for student services. Is that the question?
Yeah, see, if somebody wants to come on for financial aid or to see a counselor, is there a process in place, say when they make the appointment to come see the counselor, that they will be asked to then verify that they are vaccinated?
Regarding the process, yeah, you know, I'm not sure about the process, Jeannie.
I think, Jeannie, if I can just try and chime in just for a second. I think we have to remember though that, and Genevieve looks like she's probably going to say the same thing that I was thinking, which is, I mean, sometimes these students are not currently enrolled, so they're not going to be able to apply for an exemption. They're not going to be able to upload anything because they're not students. They need to meet with a counselor or they need to meet with financial aid because they're trying to be a student. And so that's why we're going to have the welcome centers, and that's why we're requiring folks when they come into an office to wear a mask. So if they are not, even if they're not exempt or not or have their vaccine, if they're going to be meeting with someone, they're going to be wearing a mask. They're going to check in so that they can do the self-assessment questionnaire to make sure that, you know, they're not the same thing that if you walk into Kaiser right now, they have the big signs up front, you know, do you have a fever? Do you have any cough? I mean, no one's taking your temperature anymore, but it's on the honor system to say, if you have any of these symptoms, come back when you're feeling better so that we don't expose folks. But even then, like I walk into Kaiser, I still have to wear my mask. And that's what we're going to require on campus for students to get service. So again, a lot of I just want us thinking when we're thinking about students, you know, sometimes we're focusing on who our current students are, but we've got a lot of folks. I mean, I'm on campus regularly, and most of the folks that are stopping me, asking me questions are people that are not students. They're trying to figure out, how do I enroll in a class? How do I find, you know, apply for financial aid? And they have questions about becoming a student. And so we can't forget them, that they're an important piece of this puzzle that we're trying to figure out.
Awesome. Thank you. All right. We hit up 1 o'clock. This recording will be shared to the campus. Thank you everyone for joining us. And we'll see you next week.
Yeah.
Everyone.